Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing plastic surgery in the Scottsdale, Paradise Valley area since 1992, and all I perform is cosmetic or aesthetic plastic surgery. One of my favorite procedures is upper and lower eyelid surgery, or blepharoplasty. And a lot of people come in and want to know, is a blepharoplasty going to change the shape of my eyes? And the answer to the question is generally no, unless you want the shape of your eyes changed. In the past, and still currently, there are some plastic surgeons that perform a blepharoplasty in a fashion that does change the shape of the eyes. And why is that? Well, generally, I think that probably a little bit too much fat and too much skin is removed. I think a more contemporary kind of cutting-edge blepharoplasty is one that really respects the anatomy of the eye and will rejuvenate the area. So commonly, when I perform upper and lower eyelid surgery, rather than just taking out, I will change some of the extra skin and maybe a little bit of the fat, but oftentimes I will replace some of the fat that I've taken out with fat transfer. So what I am doing is restoring the anatomy and filling back the whole area around the eye so you don't see changes over time. In previous blepharoplasties, either currently or in the past, when too much tissue is taken out, the eye tends to look quite rounded and look sad over time. So I've tried to address that by not taking out much, and like I said, restoring some of the volume there so it looks very youthful in the future. Another thing is that if I feel that someone is at risk of having a change in the shape of the eye, I will support the eye with what's called a canthopexy, and that is generally a suture in the lateral portion of the eyelid to restore some of that youthful shape and make sure you don't see some of those changes. How often do I have to go back and change the shape of the eye after blepharoplasty because of dissatisfaction? Almost never. So I think the most important thing is communication with the plastic surgeon, understand what different types of blepharoplasties there are, understand why some people have those changes, and generally it's technique dependent. So I think you should go in and look at before and after photographs, see if you like the results of the blepharoplasty that you see on a patient's before and afters on a website or so, and then go in and get a consultation. But the most important thing is to understand that it's all about communication and it's all about technique. So any questions, come in for consultation. Thank you.